Hi, my name's Amanda. I'm a level 1 nursing student. I'm here to shadow you. Can you give me a report?
Yeah, hi Amanda. So today the patient is Marta Yarn. She's an 80-year-old female, and she is a full code, stable, Q4 vital signs. She was admitted with a non-healing sacral ulcer. Activity, she has a walker, standby assistant. She's actually going tomorrow for a surgical debridement of the ulcer, and so she's on regular diet right now, but she'll be NPO after midnight. And she also has like lower back pain, so she has PRN pain medications on file. So we'll ask her to see if she's in any pain. And then if she is, which hopefully she's not, then we'll have to give her medication. And then it looks like there was a whole bunch of like blood tests done, and it found that her white blood count was elevated. So we're going to give her an antibiotic to help with that. And then she's also on IV fluids because she is also dehydrated. She has a history of multiple admissions for dehydration and pneumonia. And she also has a consult with a nutritionist and wound specialist that will follow up with the patient after her debridement tomorrow. And and then also today we'll just be doing wound care, cleaning the sacral ulcer, and then covering it with a hydrocolloid dressing. And so that's just pretty much it. NPO after midnight tonight, surgical debridement tomorrow, and then IV fluids, and then the antibiotics for the white blood cell count.
Why specifically is this client receiving this medication?
Well, because she has an elevated white blood count, which symbols probably infection, so then that's why the doctor wants to put her on the antibiotics through IV fluids.
What action does this medication have on the body?
Okay, the action, it inhibits protein synthesis in bacteria at level of 30S bacterial ribosomes.
When should you question administering this medication?
Probably we're going to check the vital signs if anything is kind of off there, and then probably if she's having any like dizziness or anything, and also if like the white blood cell count was like in the normal range, we would question.
Why does this medication have a therapeutic serum level?
Well, the white blood cell count would go down, so then you would tell if it's working or not.
Which vital signs must be monitored?
We're going to check for all of them. Mainly, also like the temperature, because if she has an infection, then her temperature will probably increase. So then if she doesn't have a temperature, then we know that it's working.
What physiological parameters must be monitored in the administration of this medication?
Well, we're going to make sure like at the site that it's not like red or sore or anything, or like swollen or stuff like that. And then also I'm going to teach the patient for like to look for rash, dizziness, vertigo, and all that stuff. And we're going to monitor the intake and outtake in a daily weight while they're on this medication.
Oh, that was my next question. What interventions must be taught to ensure this medication is administered safely in the hospital and home setting?
Okay, yeah, so we'll have them monitor the intake and outtake and daily weight while we're here. We'll also monitor the CBC, and then the serum blood levels. And then we'll also monitor for fungal infections in case anything comes up, and then monitor for hearing loss and ataxia.
What are the side effects and potential adverse reactions?
Well, ataxia is one, and then ototoxicity, and then nephrotoxicity, muscle paralysis, hypersensitivity reactions like at the site, and then vertigo as well.
How will you know this medication is effective?
If the patient is feeling well, and then also if the white blood cell count goes down.
Okay, that's all of my questions for now.
You want to go see the patient?
Sure.
Oh, hello. Hey there, how are you? My name is Jessica. I'm going to be your nurse for today. And then this is Amanda. She's a level 1 student.
Hi.
Can I have you verify your name and date of birth?
Yes, it's Marta Yarn. and I'm 80 years old.
Okay, sounds good. And then do you have any allergies? Okay, so I have a couple, I'm gonna hang just like a normal, it's the sodium chloride with potassium chloride, that's just like the normal IV fluids. And I'm also gonna hang an antibiotic for you today. And you have the right to refuse, so.
No, I think I need it. The doctor ordered it.
Okay, perfect. So let me, and then so I'm gonna wash my hands again. I'm going to hang the normal IV fluids first.
The computer, this is normal thing. So, Mr. Glenn, I will ask you many times
The computer first, but just a second.
wait, to avoid mistakes, okay?
Patience is a virtue. Meanwhile, I could check for the clarity and stuff in the sodium chloride with potassium chloride, and then check for like expiration date.
Also,
Make sure everything's
I need to speak with you about your beer, your beer of the weekend. In this moment, you have to avoid because you have your.
Sometimes it helps.
In this moment, you have your glucose level are high. Okay? No, you have to, but in this moment, it's not the ideal one.
Okay.
It's part of we have like it's part of the lack of myocardial and the it's part of that of Mr. Lightland is 67 old man, African American, is 11 old man campaign, very popular during the exam. It's actually visible distress. Distress situation is clear, posture and outside, maintain
Okay. Yes. Now.
Okay.
So, Raquel, you will see here, you verify the doctor's order, and also again, what is your name?
Gwen L. and I'm 67 years old.
You. And also, you verify
Is that hard with their hands? Like,
They just do bigger clubs.
the amount. Okay, in this case, you see the instruction of the doctor's order.
and so I'm going to verify
that
for the potassium or the sodium chloride with potassium chloride.
So
I'm going to make sure that it's the correct like
So
dose and like the rate and stuff. And okay, and I'm going to verify your name and date of birth again for you.
Marta Yarn,
okay, Mr.
And then
and I'm 80 years old.
Yes. Here.
so you click on the armband.
Yes, for the
Alright.
for the identification, and he asks again your name.
L.
And
67.
67. And now you have to click in the medication. Clinical issue.
So you do
And then verify again the expiration date,
make
the
sure this is
condition of the how is the insulin, and you verify the name of the Mr. Glenn in the and then
Although that had a cap on it.
3 times, 4 times, if there's more, it's better, okay? Take this. And it's important to 6 units, so you need to put 6 units of air, because this way you will avoid any ulcer.
And this is sterile. Hang this. Oh, I had to prime it first.
You see?
It's really little.
Yes, it is. Yeah. Now do the capping.
Oh, you're recapping?
Yes, I do capping.
Oh,
With
okay.
my hand.
So you scooped it?
Hand, by
I'm
hand.
sorry, I didn't see you do that, but thank you for telling me.
Okay. Mr. Doing, when do you want me to put the injection?
In my belly.
Okay, where did you put this morning?
Well, the nurse that was here first time, she put it in my arm, back of my.
Okay, perfect. You know that this is important to you. It's important to you.
Is the line kinked?
Rotate that place, okay? And remember that's 2 inches out of the umbilical area.
Maybe
okay?
up there.
Okay.
Is it pinched right here? Why isn't it flowing?
How do you feel? Good. Okay. Okay. You have to tell me everything if you don't feel you have any. I know that you aren't allergic, but
That's weird.
it's important that you tell
Maybe
me
shake it.
if you need something or you feel something, okay?
Okay, I will let you know.
Is it going?
But also, when you finish to do the medication, immediately you have to document it.
Document, please give it, okay.
Okay.
So in this case,
So then this is
was
sterile.
this pro.
That's terrible.
It's already sterile. Okay. I'm gonna open up the package. Hold on.
Set 6 units. 2 inches. Also, we have to be aware about the
Okay.
about the effectiveness of the medicine. Effective medication, yes. We can see that when, of course, we take a check, and the blood sugar will be low.
Okay. So now I'm going to change. This is
Okay.
kind of wet.
So
Okay.
also
So I got that hanging up, and now I'm going to hang the
because this is maybe you have something wrong
antibiotic.
that you please try to send a little more vegetables, more pizza.
How's your day going?
I'm just tired. And also,
I'm glad the pain went away.
Oh, good. Yeah, I was gonna ask you if you're in any pain, because I do have some pain medication here, and just as
I'm
needed
not
for
having
pain.
any pain. It all
Okay.
went away.
That's good.
Band, you know,
It's that.
Okay, I'll try. So then for the antibiotics, I'm gonna check for the dose and the strength and everything, and make sure expiration date, look at the clarity.
and also,
Okay, verify your name and date of birth for me again.
Marta Yarn, and I'm 80 years old.
Okay.
to the alcohol, the beer, that remember the please, okay? I will quality or carb, 15 milligrams of this possible, if you think to drink that beer, okay? And also for the exercise, up to 4 hours. Because you have to be aware about your hypoglycemia, your sign of hypoglycemia. So also I give to you some handouts for doing this and this and the time before.
Okay, perfect, thank you, I appreciate it.
So now this is your collide. So if you need something, because if you have any rash, any kind of symptom, you can call me please, because I will immediately coming back.
So let me just recap what you're telling me.
Yes, I need that you tell me back what I said to you.
Right, so you said, I have to rotate my, where I have my shots, insulin shots, and, if I'm gonna have pizza, I should eat, I mean, if I'm gonna have a beer, eat something with it, and I have to watch my feed, take care of my food because I'm diabetic, and watch for hypoglycemia, and also to do exercise.
Excellent, Mr. Lai, you will be excellent when you finish it.
Thank you.
So thanks for Raquel and me, we appreciate that you let me.
Okay, thank you, I appreciate it, you've been most educational.
Thanks to you, Mr. Glenn. So
What are you
everything,
doing?
remember.
You're filling your bag.
Yeah, your collide. Okay, perfect.
Turn it and hold it.
Okay.
Oh, like
Yeah. You're gonna need to stop it soon.
okay.